Namaste and good evening to Dr. Shantheri Pai, resource person of this evening, and participants of this webinar.
Good evening.
Before I proceed with the program of this evening, I am happy in welcoming and introducing to you the new team of members from NIMHANS, namely Mrs. Jyoti. She is already there. Please raise your hand. Mrs. Jyoti and Mrs. Fatima and Mr. Shivam, who have joined as fellow students with NIMHANS and are volunteers for conducting these webinars. I welcome them and wish them success.
Thank you, sir.
Yeah, madam, you just unmute everyone now. Madam.
Yes, I'm doing it.
Mute everyone.
Yes, I'm doing it.
Yeah. I welcome them and wish them success in their career. I am sure that they will provide all support for conducting these webinars as their predecessors have been doing. Reverting to this program of the day, Dr. Shantheri Pai is an highly educated and experienced doctor. After obtaining her MBBS degree from JJMMC Medical College, Banglaore in the year 2018, she completed her post-graduation in Psychiatry in the year 2022 from the prestigious Dharwad Institute of Mental Health and Neurosciences, Dharwad. She had secured 4th rank in the university examination of Rajiv Gandhi University of Health Sciences, Karnataka. This shows her academic excellence. 1 year of senior residency was completed in the year 2023 from NIMHANS. Later, she had joined as an assistant professor in the Department of Psychiatry at JJMMC Medical College, Davangere, where she is currently teaching and preparing future doctors.
Thank you, sir.
One second. She has taken keen interest in the area of geriatrics mental health. She often visits old age care centers where she interacts with the elderly in order to provide them support. This is helping her research activity also. As a result of her research, she is of the view that aging leads to gradual deterioration of organ system, leading to variable loss of function. However, there are a few tasks to be carried out in late adulthood. These are such as maintaining self-integrity, physical health, pleasurable activities, adjusting to the changes in the physical health and professional life. These tasks require resources from within and also external environment. Thus, psychological and emotional needs are hence this topic is of importance to identify them and provide support in better ways. I am sure Dr. Shantheri Pai will elaborate on all these aspects in her presentation. As a meeting hygiene, I request all participants to keenly listen to the presentation by keeping their audios in mute. If they have any question, they can type them in the chat for her to reply at the end of the presentation. If time permits, we can allow participants to raise questions after unmuting. I am sure all participants will follow these guidelines. Yes, Dr. Shantheri Pai, while thanking you for your time and efforts to share your knowledge, I request you to kindly go ahead with your presentation. Kindly go ahead, Doctor. The meeting is yours.
Thank you, sir. Thank you for the introduction. Good evening, everyone. First of all, I'm grateful to the Vayomanasa Sanjeevani team for giving me this opportunity. And I welcome all the participants here for attending the session, all the elderly and their caregivers too. So this topic was chosen as usually importance is given whenever a person has an impairment or there is significant dysfunction in his daily activities. So when we are in the clinic, we get patients in a state wherein they either would have developed depressive disorder or some sort of psychological disturbances. But usually the dysfunction might have started long back and it might have not been noticed by the family members or the person himself. So that made it important to discuss about this topic, wherein we'll be just discussing the unmet needs of the elderly, be it psychological or emotional. So I will be sharing a slide. Hope I was audible till now.
Yeah, everything is fine, Doctor. Kindly go ahead with the presentation.
Are my slides visible, sir?
Yes, Doctor, it is.
You may have to go for full screen, madam.
Yes, sir.
No, this is fine, sir. This is fine. Full screen has come, sir. It is fine.
I'll do it, sir.
Yeah. This is fine.
Sir, is this
Yeah.
visible in full screen now?
Yeah. This is full screen. Yeah.
Okay. Old age is a shift from pursuit of wealth to the maintenance of health. And aging is gradual decline in the functioning of all body systems, and not all organ systems deteriorate at the same time. That is a lot of time, even when the person is 90, 95-year old, they'll still have cognitive abilities and physical capacities to carry out their day-to-day function. So where does this need arise from? So one of the reason for these needs are that once a person is in late adulthood, there are changes in the task that they take, such as taking grandparenthood, caring for their own parents, retirement from their work, increasing spare time, and also physical health and functioning. There are some more tasks such as life review. Also, they might have to deal with death of the loved ones and also have to divest from their attachment. So, along with all of this, a person still can have pleasure and convey sense of competence if attention is paid to regular exercise, healthy diet, adequate and preventive maintenance medical care. And as a person, as and when there is aging, it does not mean that person loses his emotions or the way he reacts or responds to any sort of stimuli. It is same as what it is there in the young age, but the person might perceive it in a different way. So with this background, I'll go to one of the saying by Eric Erikson, wherein he said that old age is not just about deterioration. There is development, some sort of psychosocial development that is occurring in this age also, wherein some conflict arises and the person will have either despair or integrity. So successful resolution occurs whenever a person has a sense of having lived one's life well and peacefully comes to term with the change that is happening. So also the same has been explained in the ashramas as per Indian literature, wherein the third ashrama is about vanaprastha, that is between the age of 51 years to 75 years, wherein a person retires from his works and hands over responsibilities to the next generation. And the further stage is sannyasa, wherein a person gives up all the materialistic possession. So with this, we'll see what is emotional well-being in elderly. We saw that a person has to take up so many tasks in his late adulthood. So there are a lot of positive and negative emotions which arise during this late adulthood. And a balance between this positive and negative emotion is responsible for emotional well-being. Also, happiness, life satisfaction, and balance between emotion comprise of this emotional well-being. And as we see that as person ages, there are change in his goal, and also person starts emphasizing emotion and meaning to his life. And emotional well-being is also dependent on the physical health. So as the organs deteriorate, we know that people develop a lot of chronic illnesses or long-term illness in their in elderly age group. So some of the physical health issues that are seen are arthritis, cardiac diseases, cancer, respiratory issues, then dementia or Alzheimer's disease, osteoporosis. There can be diabetes mellitus, hypertension, or even depression. Some sort of psychiatric illnesses might also develop in the later age. So all this, a lot of physical disability might also occur, wherein if a person develops stroke and he has some sort of paralysis, then there is some sort of physical disability wherein he might have to depend on others for his daily activities or grooming. So that itself might be the reason for need. And also when people are diagnosed with cardiac disease or hypertension, diabetes, then they'll be prescribed multiple drugs. So taking multiple drugs in itself might cause a lot of distress. Also, sometimes whenever we are in the clinic, people come to us saying that there was some sort of adverse reaction to the drug. So whenever we prescribe them something, they'll start coming to us with the anxiety. What if the similar complaint occur again? Or what if I become disabled? What if I am not able to take care of myself because of the side effects of the drug? So all of this might lead to emotional disturbances. So with this background, um, there are some of the studies done in the Western part of the world wherein unmet needs of the elderly, which were frequently reported, where one is company. That is, people go on losing social ties as they get older. So there might be few social contacts, loneliness, and social isolation among elderly. The other unmet need is the daytime activities, wherein people might have difficulty in regular, appropriate daytime activities, and also information. A lot of time, people may not receive information for whatever physical ailments that they're going through, and it might only be conveyed to the family members, and hence they may not get a chance to decide on what treatment they want. So this information related need is also there, and caring for another. So elderly does not mean that they do not take care of others. A lot of time we have seen a patient who is 60-year-old coming with a 90-year-old father or mother whom they are taking care of, and also their own children if they are taking care of. There are a few cases wherein mother is the caregiver for a 40-year-old or a 50-year-old male patient who comes to us, or a female patient who comes to us. A lot of time, if it is a postpartum a case, a postpartum mother, then her mother will be a caregiver to her. So some of the unmet need is wherein caring for another becomes difficult in elderly, and also accommodation. A lot of time basic sanitation itself might be a difficulty, and people are inappropriately or inadequately housed. So how to deal with these unmet needs, we'll be seeing further. So, and also some of the psychological and behavioral disturbances occurring due to these needs are sadness of mood, that is wherein a person repeatedly tells that they're feeling sad, or they might show it in a way wherein they're agitated, or there might be refusal to speak to people about whatever they're going through, or complete social isolation might also be seen, or anger for trivial matters, and a lack of interest might be there, in wherein a person may not involve in any sort of interaction, or might refuse to do pleasurable activities that the person was doing earlier. And also they might report of disturbed sleep, impaired daily routine, impaired cognition. That is, a lot of time people come to us reporting of forgetfulness. On asking them further, we find out that they are sad, and that is why they are unable to attend to what is happening around them, and that is where this forgetfulness is coming from. So that itself might be there, and a substance addiction in itself might be seen in some of the elderly, wherein they start consuming alcohol, or there might be smoking nicotine. So these are some of the psychological and behavioral disturbances that are seen. So coming to how to deal with these needs. So first one is the autonomy and the integrity. Autonomy is grounded in the respect for patients' ability to choose, decide, and take responsibility for their own lives. That is, as I said earlier, if we provide them with appropriate amount of information about their illness or their condition, they have the ability to choose and decide. So it becomes important that we listen to them, whatever they are trying to convey. And at the same time, person's very existence matters. And no matter what their physical and mental conditions are, they must be respected. So just that they have some depression or some agitation does not make them incapable of taking decisions or taking their own responsibility. So it is important that we respect their decision and sit with them, discuss with them what they want to do in these terms. So that is about autonomy and integrity. And as I said, the very existence matters. So remind them of their worth. Then coming to life satisfaction, as it was already discussed about developmental tasks in the adulthood, one of them is the life review. That is, a person actually thinks about the life that he has lived. Satisfaction is higher whenever a person thinks he has lived better, or um, he has fulfilled some of the responsibilities or the goals that he had in life. And increased satisfaction is seen in secure attachment. That is, when a person feels secure with his family members or his relatives, that is when he'll have higher life satisfaction. That is, he can trust others or he can believe in others. And also, people who are open to take help. Whenever a person is open to take help, they will share whatever is going on with them. They might find solutions for their problems faster, and that is how this improves their life satisfaction. Also, people with increased social support, that is immediate family members or their friend group or a close group of people with whom they can share whatever is happening to them, or if they are experiencing all positive emotions with them, then they'll have better or life satisfaction. Also, people with lesser physical and mental health issues, so this improves life satisfaction. Also, spiritual reminiscence positively affect hope, life satisfaction, and well-being of older adults. And assisted living facilities compared to hospitals gives more life satisfaction. That is, when a person is in hospital, he will usually be evaluated a number of times and always be assisted by a nurse or the attenders. Whereas once they are shifted to assisted living facilities, they will be allowed to carry out their work slowly on their own independently, or there will be a person who will assist them along with good amount of privacy given to them. So that also improves life satisfaction. So whenever a person is doing this life review, it is better to enlighten yourself on what really matters. So, being mindful or think, it is always better to think about positive events in the past than thinking about the negative events. So, whenever caregivers can help, I mean, a lot of time caregivers come to us saying that my father is unable to remember some of the positive events, or few days back there was a family function and he enjoyed that, but he's always thinking of the negative events or his physical problems. So what to do in that case? We tell them, you remind him of all the positive events, remind him of his worth, and also experience your life from others people's perspective. That is, usually in old age, some of the young family member might come to them and tell them that you had helped me in certain way, you helped me financially, or you helped me with something, or you talked to me, you guided me to take up some course and I'm doing well in my life. Yeah, accept that gratitude, or remind yourself that you are capable of doing something. And when emotional information is measured, older adults often excel. That is, in elderly, it is often noticed that there will be some forgetfulness to the recent events that have happened. But if you remind them of something emotional, they'll explain it to you with all minute details from the past. So that is something noted in one of the studies. And people dwelling on negative past events will have higher risk for interpersonal issues, worse physical health, and number of negative life events. So, to improve this life review, it is always better to start with mindfulness and also some of the spiritual activities which the person has interest in. So, this was about life review. Also, to improve life satisfaction, a person can slowly start letting go of all the attachment, whether it is materialistic belongings or also the interpersonal attachment. And as the person starts aging, there will be some sort of symbolic attachment that he develops towards God or loved ones who is no more. And this becomes more and more prominent in old age. For example, one of the elderly women who gets her child who is mentally retarded, and she has been supporting her all throughout. So um, the child has some sort of behavioral disturbances for which she was receiving treatment. And we asked the mother about how do you feel about this, or what do you think, who will be taking care of the daughter on a later date, or when you are unable to do so, who will be taking care of the child? Then she said, God will take care of whatever issues she might go through once I am not there. So they develop this symbolic attachment. And this has been said multiple times, expressed multiple times by a number of patients caregiver. So some of the problems in divesting that are seen are needing to constantly be around a friend, family member, or romantic partner. And also sometimes people might have difficulty because of the anxiety about being left or abandoned by a loved one. And individual differences are seen in coping with loss of attachment. That is when there is a death of a loved one. Everyone does not cope with it the same way. Some might develop depressive symptoms, or some might go for social isolation. Some might become more spiritual, or involve themselves in some of the social work. So there are different ways of coping with this loss of attachment. So one more topic to discuss is about retirement. Some of the psychological effects might arise because of retirement, such as loss of identity and purpose, and social isolation and loneliness, lack of routine. So this is something we see often. That is, a person might be going to work at 9 in the morning. For that, he earlier used to wake up at 6:30 or 7 in the morning, go for a walk, then have his breakfast, get ready, groom himself up, and then go to work. And probably come back by 6 in the evening, have some conversation with his family members, tell them about how his day went. So this might be one of the routine that would have said. And once they retire, waking up in the morning itself might feel like a difficult task, or might feel very effortful, because there is no purpose after even
elderly allows
at 6:30 in the morning. They may not have anything to do after 9 o'clock or 10 o'clock, or after their breakfast. So there might be change in their routine, and later on it might become very erratic, wherein they have their breakfast 12 in the noon, or lunch later in the evening hours. So this shift might also be seen. Also, social isolation is reported a number of times, wherein they will not have the group that they had when they were working, or it might become difficult to go back to the same people again, wherein they see them having their own routine, and they already and this person has already retired. So such crisis might also occur. Also some cases wherein financial challenges might be there, and they might have to depend on their children. And some of the people might report with the fear of being dependent also. So these are the psychological effects. So what to do during this enormous spare time? So one way of changing this is by adding structure and variety to the life, and revamping hobbies or passion that were forgotten due to the responsibilities of professional career. So often when we encounter some of the patient, we ask them what were their hobbies. They take a lot of time to recollect, because they will be consumed so much with their work that they would have forgotten what were their hobbies. They come up with only some things like watching TV, or just going for a walk. So then we remind them of what they were good in, or we give some of the examples. For example, either drawing, reading some novels, newspapers, doing some crosswords. Then they recollect, yeah, that they used to like some sort of music, or they used to write some poetry. So remind them of their hobbies, or revamp all those hobbies or passion that which were forgotten, and involve in social gatherings. That is, whenever there is a conference or meeting that is there in their workplace, they can go attend that, so that they'll meet their old friends. and also doing household chores without rigid routine. A lot of time, this 9 to 5 wherein they used to work, or 9 to 6 wherein they used to work, uh, that is still empty. So we tell them to go ahead and start doing some of the household work. For example, folding their clothes and keeping it in a specific place, or just washing one or two utensils. So it can start with that. That need not have a rigid routine because they have a lot of time left. And then there is getting in touch with the friends or relatives, sharing their experiences, and also giving rewards for successes each day. So journaling also helps, wherein if a person is unable to recall all the positive events, they can do this journaling, wherein they write down three good things that happened in a day. So that itself might help with spending time. And as we
1
were
minute, doctor. Just 1 minute. See,
yes,
you said that rewarding yourself daily on a daily basis for
yes,
all the people. How to go about with that, doctor? How to reward oneself? See, give yourself reward for success each day, successes each day. That
yes,
was the last thing.
hmm,
Can you just elaborate slightly on that, doctor?
yes, sir. So usually, uh, probably if they keep their clothes in a certain way, they might have thought that today I'll arrange all my clothes or arrange my books in a certain way. So they would have pre-decided that, yeah, if I finish reading a book, I'll buy one more. So it can be some simple task like that, wherein they go ahead and buy something, or they might gift themselves um, a snack that they wanted to have since a long time. So it is some token that they give to oneself. Or a lot of time we tell them that you can go on collecting these rewards. It can be just small star in their book wherein they mark that I did something today. So just like in LKG, UKGs, our teachers used to mark in front of good a star or two stars. So once they collect 7 stars, then they go ahead and buy something for themselves, or go on a small trip with their family, take their spouse for a small picnic or a walk. So rewards can be different. It need not be bought with money a lot of time, and it can just be those pleasurable activities which they want to do. So these
Yes,
are the
doctor.
yes, sir.
Thanks, doctor. That helps. That helps. Yes. Yes, doctor. Thank you.
Yeah.
What
Then
do you want to
um, then going to bereavement and grief. So grief is part of everyone's life, and it is a normal response to significant loss. There is no right way of grieving. So this is something that we need to understand, that there is no right way, or a person need not stop feeling sad. It is like a lot of time people tell us somebody died 15 days back and this person is still crying. So such comments should not be done. So common grief responses include disbelief, numbness, shock, inability to accept the loss as a reality. They might be in denial that some person is no more. There can be anger or frustration that the loss occurred, sadness with feelings of helplessness, despair, and isolation, changes in energy, appetite, and sleeping habits, yearning for the person that was lost, relief that any suffering is over, and difficulty focusing and making decisions. So, these are some of the responses, and how to cope up with this grief. First thing is not to judge yourself, accept where you are in the grieving process. So if you're feeling sad that some person is no more, accept that depression or sadness. Or if you're feeling disappointed that a lot of time people tell this that my son was taken away, God did not do justice to me. So people person might be feeling disappointed. So accept that. Allow yourself to experience the full range of emotions. That is, it can be from sadness to anger, um, and a whole lot of emotions that a person is feeling. And also be truthful about how people can be of help to you. Talk regularly with friends to remain connected. Use another form of expression, such as keeping a journal and making art. So this is one more way of coping, where a person can write letters to the person who is no more, or can share his day-to-day activities in that journal, whatever he wants to tell it to the other person, and structure your time alone. So this might take some time, wherein a person might take around 3 to 6 months to slowly adjust himself to the change that has happened, and spend time alone in the nature and by in meditation, and do something to help someone else. So these are various ways of coping with grief. So one more need is interpersonal role changes. So probably most of us have watched this movie Bagban, wherein Amitabh Bachchan retires from his work, and he'll be at home. They'll have a small gathering, and later on there will be a discussion about where will their parents stay, and slowly the interaction between children and grandchildren and parents change in this movie, wherein we see that children may not validate whatever the parent is telling, or the daughter-in-law, son-in-law, they have different ways of communicating their needs, and they had different perspectives in the movie. And also we saw that initially the granddaughter did not understand what the grandmother was trying to explain it to her, and later on there came a point wherein she understood. So understanding each other's perspectives, ideas, and also understanding ways of communication becomes important when interpersonal role changes occur. And also, changes in the family structure is seen over the years. That is, earlier there was this joint family structure, wherein there were 3 or 4 children, daughter-in-laws or son-in-law, staying under the same roof, taking care of the elderly, and they had lot of time, wherein one person would take um, responsibility of the mother for some days, and the other, there was some transfer of responsibility from one person to the other. It might be from taking them to a temple or a social gathering. One person might accompany them once, the other person might accompany them other time. And there used to be grandchildren in the house who would play some board games or share whatever happened in their day-to-day activities. So that structure was there. And recently there has been this nuclear family system, wherein both the children might be working, or the grandchildren might have very strict academic schedule, because of which they may not be able to give time to the elderly. So that is one of the need, and this itself can be part of the unmet needs of company. And then the other unmet need is privacy in old age care. This is nothing but a retreat to the individual, can also be called as solitude, intimacy, anonymity, and reserve. So it can be divided into different domains, that is physical, psychological, social, and informational. So physical is the extent to which one's body is physically accessible, and concerns about personal space and marking out of the territory. A lot of time, elderly might require help whenever they're grooming themselves up or in their day-to-day activities, and there might be a nurse so taking care of them. So that does not mean that they'll not have solitude or privacy. So it is always better to explain them about the procedure that they're doing, or the way they are trying to care for the elderly. And also, then there is psychological privacy, wherein a person requires some amount of emotional privacy also, wherein they can sit, introspect about their day. They should have control of their mental process, or the ability to form values, and also their personal identity. So it should not be imposed upon them that you have to act a certain way, or speak a certain way, or you have to think a certain way. And then there is social privacy, that is management of social contacts, control over the participants, frequency, length, and content of interaction. That is not to keep monitoring them about how they are speaking to someone or who is visiting them. Their security is important. At the same time, they should be allowed to have some conversation with their. They should be actually encouraged to have conversations with their friends and interact with any relative that comes home, so that they feel that they are part of the family, or also that they should be allowed to manage their own social contact. And informational privacy is the control over personal information collection and distribution. That is, whenever they provide any sort of information, be it during any sort of interview or during any medical checkups. So that also need to be kept confidential. So this is about privacy in old age care. And then comes the important factor, that is social support. All throughout, we saw that social support was one of the major factor, that is, be it about life satisfaction or grieving, or in cases of retirement or interpersonal role changes. Social support is of importance and it improves emotional well-being. Helping others increase self-esteem, engagement with life, and aging well. That is, social support is not just about seeking support for oneself. A person himself who is elderly can help others with by sharing their experiences, by telling them, showing empathy or being kind to others. And also, receiving social support is more important during stress. And a lot of time, social support reduces stress related mechanism and increases reward related activity. Joining groups that are based on previous occupation, religious groups, area of residence, so that it eases consistent meetings or meeting at a regular interval. And also, social support helps with sharing experiences. And also, whenever a person is in some um, group, they might share about their creative activities or their hobbies, and they might indulge in such relaxation activities too. So yeah, this completes my presentation or talk. And one of the important thing that I would like to emphasize again is that giving importance to positive emotion helps with life satisfaction, also the emotional well-being. A lot of time when a person is in pain or going through lot of stress, they can remember only the negative emotions or the anxiety that they're going through. So remind them of their worth, remind them that they are capable of um, slowly coming out of that phase wherein they're feeling stressed or anxious, and remind them of their positive emotions. So thank you, one and all. This session is open for questions or
Yeah.
any.
Thank you very much, Doctor. It was a very wonderful presentation. So I would now see, in fact, there are already some appreciations available in our chat. People have been appreciating the presentations, Doctor. But of course, yeah, thank you. Thanks for that. In fact, now I request participants whoever wants to raise a question, they can raise. In fact, Mr. Tangarajan has been writing number of points that, okay, how things happen. Okay, I mean, this is the reality of life. What I can do, see, what I am not responsible for what others are doing. What is that how I can carry on with this? This is the thing that we are now talking, isn't it? So I think in that context, I think whatever you have presented is an excellent presentation, Doctor. Thanks for your time. Thanks for the presentation, Doctor. So, I mean, I request participants whoever wants to raise any question, please raise it, please. Please unmute yourself and raise it. The floor is open to you. Sir, Tangaraj sir, would you like to say anything?
Yes.
Please, sir. Please go ahead, sir.
Very good presentation by the doctor.
Thank you, sir.
As usual, with the slides also to understand what the present condition of the senior citizens. But as you said, we have to think ourselves and live peacefully after 60, 70, 80 like that. we should not depend always others to care of us. We are having a mind to pull on our, but social support is very much.
Sir, sir, unmute, sir. Sir, mute. Sir, you are in mute. Tangraj, sir, you are in mute. Please unmute yourself.
The social support is very, very important. Nowadays, we have to mingle with others, particularly like-minded people, to have fun and other joyful remembers and other things. That's the main reason for senior citizens. Thank you very much.
Thank you.
Ramnath sir, you can unmute and speak. Unmute yourself and speak, Ramnath. Ramnath.
Not coming. Hello.
Yeah, it is coming, sir. Yeah.
Yes, thank you. Good morning, madam. Good evening, madam. Very, very nice speech. Shortly and crisply, I explained everything. But one small doubt is there that you are having the psychiatrist only for dyspnea patients. Is different from dyspnea and psychiatrist, and is due to some high BP like that. You are saying that 51 to 75 years Vanaprastham. What about the above 75 years like me? I am 78 now. So what are this thing? Any symptoms? How to suppose psychiatrist? What are the symptoms to happen? A person. One by one, please.
Yes, sir. So, as in the fourth ashram, it is the fourth ashram, sir. That is sannyasa. It is given. So
okay.
The purpose is to let go of the materialistic possession and also some sort of interpersonal attachment. So during this phase, people might develop some sort of crisis wherein their children, they might be losing their children or their own spouse. So grief is one such symptom that they might come up with, and also lack of emotional support, social support.
Okay.
So and also some amount of cognitive decline, that is memory decline will be there, attentional
Memory loss. Memory loss, which year it comes, madam? Memory loss. Memory loss, in which year it comes? Memory loss.
Varies from different. It varies in age, sir. Some of the sort of memory disturbances might start even before the age of 60. For some people, even till the age of 80, 85, they may not develop this memory disturbances. So one way of maintaining that is by doing cognitively stimulating task. For example, learning a new language or reading books, trying to solve some of the crosswords, playing chess, or some board games might also help with it. So,
madam, evolve that any medicines are available to reduce my psychosis this thing defect. Any medicine available? Any medicines available to reduce my psychiatrist or memory loss situation?
There are some medicines which have some cognitive enhancing effects. So, yeah, based on the condition, they prescribe. So, depending on memory.
Thank you very much. Thank you very much, madam. Nice.
Any other person likes to? In fact, one thing now that
can I speak? Yeah, can I?
Yeah, who is that, ma? Please. Who is that,
Hello?
ma? Yeah, please go ahead. Please go ahead.
I'm Vrinda here.
Yeah, please go ahead.
Yeah, thank you so much for
switch on your video, ma.
Yes. I will.
Please start the video, ma.
Yeah, thank you so much for organizing this talk. This is need of the hour. But my question is I would like to, this person who has just spoken, actually he was asking that he is suffering from a memory loss, and is there a medicine? So I wish that you could guide him, saying that he should visit the geriatric clinic in some hospital, because he said that he is suffering from a memory loss, and is there any medicine? That means he is suffering from a memory loss and he needs medical help. I wish the answer was given. Okay, so please convey to him. And
Yes.
secondly, hello.
Yes.
Go ahead, go ahead, please.
Yeah. And secondly, I wanted to ask you, like, suppose there is an elderly person in the house and he doesn't have much hobbies. Like Madam said that he can read a book, he can do a crossword. See, the crossword person will be able to do only if his memory is intact, right? But if his memory is, he's losing his memory, he's not in touch with memory, how will he do the crosswords and the complicated games, right? So in this scenario, can you suggest something else? Apart from the reading book and all, the reading book again, as you said, that if the person is in depression, then also there can be it can affect the cognitive domain. So can you suggest some simple activities so that suppose for example, he's a rural person, he's from
Yes.
the village, he's not educated, how will he read the book? He's illiterate.
Yes.
Okay, so for such kind of people, why I'm asking you, ma'am, you might feel why I'm going into detail, because I'm a psychiatric social worker. Okay, so I just want to know what can we advise. Suppose he's uneducated, he's illiterate, his memory is affected, he doesn't have much social circle. Okay, what can we advise such patient? How to keep them busy? He doesn't have hobbies.
Yeah.
From all sides, all negative, I'm telling you. Why? Because we want to learn. I want to learn how to guide such people.
Yes. Ma'am, this is a really good question because a lot of time these are the patients that we see in my OPD.
And ma'am, sorry, before you tell me, please, that gentleman who was asking you, he's asked you that I'm suffering from a memory loss. Madam, is there any medicine? Please advise him to see the doctor in the geriatric clinic from wherever he belongs to, whichever city he belongs to. That is my humble request to you.
Thank you, ma. Thank you. In fact, I know the gentleman who raised the question for a very, very long time. We are classmates. I will definitely tell him. Don't bother. Right. He
Yes.
knows that he really goes to the doctor. See what happens, when people attend these kinds of webinars, they always like to check whether they are receiving the correct medicine or something like that.
Okay.
That's the only thing. He is fully aware. He is fully taken care of. Absolutely no problem.
Thank you so much. Now, now madam can give reply to my, okay, now ma'am can give reply to my question, please.
Exactly. Yes.
Yes, ma'am. So I was seeing one of the patient like that, wherein he came from a rural background. He was a farmer, and since 2 years he has not been going to work. And as he was quiet at home, the family members were okay with that. They brought him to us only because of 1 week of disturbance, wherein he had difficulty sleeping or having food. So slowly we asked them about what does he do from morning till night. They said he'll just sit in the at the entrance of the house, and he'll look at whoever is going here and there, and he'll try conversing with his grandchildren, but he may not be usually speaking more than 1 or 2 words. So we told them that whenever uh, in the morning, as soon as he wakes up, if once he finishes it with his daily activities like taking bath and using washroom, so tell the sons who go to the farm to just take him along, because he did not have any other sort of physical impairment. So we told him that he has to be monitored. At the same time, they can still take him to the farm, tell him to just help them slowly with 1 or 2 work, like wherein he can just pick up some of the plants or some flowers that are growing or some fruits, so that he does not put up lot of exertion, but at the same time he is kept occupied with some work. And they need to adequately hydrate him even when he goes to the farm, and let him take a break after 30 or 40 minutes, wherein he is brought back by another son whenever they're coming home. And then we slowly started telling them that once he has his, I mean, once he takes bath, once the clothes are brought back inside the house, let him try folding that. If he is not able to do that, it is fine, but let him try. Don't let
Mm,
him just be alone. And
mm,
also, sometimes they had this fear that what if he gets lost when he goes to the farm. So then we started explaining that they can give him some grains which he might have to separate and keep, or
mm,
even when they're trying to clean some vegetables, make him sit along, let him try doing it. So
mm,
it is to involve them in such small activities at home. And also we started telling them that they can start um, I mean, reminding him of what he had for the breakfast, what he had for lunch, what he had for dinner, and also to orient him to the day or any sort of festival that they recently celebrated. So these were some of the steps that we I explained to the family members. And also the daughter-in-laws and son came up with some issues, like it is sometimes difficult for us because I have sons had to go to the farm, and other family members had to look at the children. So we said, as and when you're working, give them some tiny task like this, which they may or may not complete, but they'll be kept occupied so that
mm,
some cognitive reserve is still there. And also told them to improve interaction with them so that every day one grandson or the grandchildren have to just tell him about their daily activity, or whenever they're telling some of the experiences to their mother, they can ask this grandfather to just sit there and listen to what they're telling. And also he had difficulty understanding instructions also. So we told them to break that instruction into just 2 or 3 words maximum, so that he can attend only to those 2 or 3 words and understand them better. So these were some of the steps that we had taken.
very, very nice. I'm really happy with
Fantastic.
your reply. Thank you so much.
Thank you, ma'am.
Very nicely you explained that.
Yeah,
Thank
that's excellent, doctor. Excellent. See, in fact, very practical also. Only thing is, we need
Yeah.
to also remind them that this is just to keep him engaged, not to get anything out of him. See, ultimately, you
Yes,
should
yes.
get into a blame game. I asked you to do this, you have not done that, etc., etc. That should not happen. Only to keep him
Yeah.
engaged. It's a beautiful,
Yeah,
beautiful
no,
very
but sir,
practical.
what has happened now? But
Ah,
sir, what has happened now? These days, social interactions are very less. People don't have friends. Old people though don't have nobody. Youngsters, they don't. They just disregard their own grandchildren and own children disregard. So where will the others speak to the old people? So in this scenario, sir, we really need to see some other alternatives because the social interaction is declining, right?
you are
So,
right. You are right.
but now whatever madam said is quite useful
Yeah,
because
it's
within,
practical. Yeah,
yeah,
very practical,
because,
very practical, and just give them small
yeah,
work. Not with
yeah,
an
very,
idea of getting work done, but with an idea of
yeah,
engaging this person. That's the idea. The
yes, yes,
underlying idea is
yeah,
different. It's a beautiful.
yes.
So this is a way
Yeah,
forward.
beautifully explained.
Yes, sir.
Yes, yes, she's beautifully explained. Yes, thank you so much. Thank you so much.
Thank you. Thank you, ma'am. Thank you.
Thank you so
Uh,
much, madam. Very beautiful suggestion. Very beautiful suggestion. Thank you so much, sir.
Yes, yes, this was really beautiful because I am asking from the general population, view, because this is what we are seeing every day.
yeah, you are right. You are right. You are right.
Yeah, thank you.
I think another person wants to raise a question. Madam, can you just raise it? Hello.
Hello.
Please go ahead, ma'am. Please go ahead.
Yes. First of all, thank you for organizing this. It was a very nice talk, ma'am. And my question is, you mentioned in your PPT that these elderly people have to maintain contacts with their friends and all that. But some people, they are not in contact with their friends. They have changed their cities, house, everywhere, and they don't have their contact number or even their family's number. So in that case, how do they have their contact with their friends?
In that case, probably building a new social network that helps them, wherein it can be based on their interests. For example, whether it can be their spiritual interests or some of the activities. They might be attending yoga or meditation classes, or it can be their place of residence. So one such patient used to come to us, wherein she was around 60-year-old female, and she used to take care of the family, and her husband had a stroke, and he was unable to carry out his daily activities. So and she did not have a mobile phone or contact with her friends. So one of the things that we asked her was to go to the nearest temple, whichever was there. She said that she used to like to go to the temples. So we told her to just go to the temple, sit there for a while, meditate, and then you might find people with whom you were earlier in contact. Or you might slowly build new social network, wherein there might be some puja going on, some event that is happening. So she slowly started developing a social network, and this is one way of doing it. And also we see people going to the park, wherein they might carry out some exercise, and there they slowly start developing a group. So this is something that can be done if they're unable to connect with the previous old friends.
Old friends, yeah, old friends also you try to connect, start with some new friends. That's the idea.
Madam, I didn't understand about the temple part. Can you explain again? They go to the temple, how they find the company?
Ma'am, there are some of the gatherings that happen in the temple, wherein there might be a special auspicious day wherein people meet for
Yeah.
certain puja, and usually they converse when they are serving prasadam, or when they have to volunteer for some of the other activities there, be it preparing a garland, or just
Yes.
clean the temple premises. They might have to start a conversation with the other person there. It could be the other people who are volunteering, or the priest.
Mhm.
So this is something from one of the patients that I used to see. So because she said that with all the family responsibilities that she was taking, it had become difficult to find friends, or to do some pleasurable
Mhm.
activities. Then she herself came up with this, that I can go to temple once a week, or once in 3 days, whenever there is a puja or something. So then
Mhm.
she also told us that yeah, she used to make garlands earlier, which she can try doing it again.
Oh,
So,
okay.
so
Yeah,
sometimes
Mhm.
that's
it's
fine.
better to ask.
Yeah, yeah. Dealing with, I mean, doing some voluntary activity definitely engages people, ma. That's one thing we have found. But we encourage
Yeah.
people to do lay sessions also. We lay lots of emphasis on this doing voluntary activity. So, I mean, lots of people are needed there, and we can slowly start doing that. That's very good. That's very good answer, ma. It's a very good practical way. Ramnath, would you like to ask anything?
Thank you, ma'am.
Ma'am, did I
Hello,
clarify?
Yeah, go ahead, go ahead.
hello, hello.
Yes,
Yes,
ma'am.
Go ahead, go
Madam,
ahead.
one last thing. I am doing yoga, exercise, and meditation. Okay, and walking also, at least for 2 hours in the morning. Evening also walking I am doing. So that even helps me for avoiding the this thing, memory loss.
sir, it
Helpful.
helps you with improving the cognition, wherein you'll be paying attention to some of the environmental cues around you, when
Activities. Okay.
you are listening to the bird chirping, or some of the
Oh,
animals around you, or some
okay.
conversation also, whenever you go for walk. And yoga helps with attention. So
Okay.
yes, sir.
I
Thank you,
mean,
madam.
doctor is a busy doctor. So we are already hitting 5 o'clock. Jyoti, would you like to say anything, ma'am? Jyoti,
Actually, ma'am, it is really very good session you have taken. We have understood a lot of things regarding the psychological issues for the elderly. It was really a very good presentation. Thank you, ma'am. And thank you, the audience, and Zambunathan sir and Shantheri ma'am for joining us. Thank you, sir.
Thank you so much.
before I close down, I would like to again thank Dr. Shantheri Pai. See, she has been taking lots of interest. The kind of presentations that she has given is, it only goes to show the kind of interest that she takes. Lots of presentation, lots of materials have come up in the presentation. Thank you very much, ma'am. My request is that you can kindly send this presentation to us by mail. By mail, I will share my mail ID to you, so that what we can do is we can share this in our group also. So whenever people get a doubt, that will be useful to them. Therefore, these are all the webinars where we don't, give any kind of presentation or any kind of return gift or anything in time. What our prayers is that we pray God to shower on you and your family all that are the best in life, ma'am. Because you have taken so much of effort for presenting this. So this is our return gift, ma'am. Please accept it. We continue to pray for you, ma'am. Thank you very much.
Also, we will be uploading this to YouTube channel. We can get it from there also.
Yeah, that is as usual.
Yeah.
That is as usual. Therefore, these presentations alone, that will help in a number of ways. Okay, ma'am. Anything you would like to say, ma'am?
No.
Thank you so much, everyone. Thank you for this opportunity. If there are any mistakes in the presentation, or if I'm not done, if I have not answered or clarified any of your doubts, you can contact me anytime. Sir has my contact number. Thank you so much.
Thank you. Thank you. God bless you. Bye. Jyoti, you can close down.
Yes, sir. Yes, sir. I will end the meeting now.
Yeah, please.
Thank you.